Thank you. Let me do continue. Okay. So my name is Mary. I'm an occupational therapist. Kind of our big thing is looking at occupational function and how that kind of relates to the activities of daily living and things that we do. A lot of that also involves kind of positioning and how we're interacting with our environment. And ergonomics is a big discipline of that. Our work environment, we spend a lot of time at work, and for some of us a lot of time sitting at a desk at work. And so this presentation is really kind of geared more towards that side of things. It's more office setup. So I'll kind of go over options. I'll really reiterate a lot that there is no one size fits all. So if you do have specific questions, please feel free to email me, because based on your needs, it may not fit into a nice happy box. So I'm happy to answer questions as specifically as you have them, but hopefully this will kind of answer some questions that you have as well. Also, kind of with the COVID pandemic, a lot of people have transitioned to working from home, and so we're seeing increased kind of musculoskeletal injuries resulting from movement patterns that are happening from poor posture, poor fit within our work environment. And so that's kind of what I want to talk about as well. So if you're just looking at the picture right here, it's you can see how posture, even in the same setup, just that posture where it can create some dysfunction and some hot spots, if you will. And then moving forward, I do have kind of some pictures of some home setups that we'll kind of look at, a little slideshow. I want you to just kind of look at the pictures and see if you can kind of identify, in your head, what might be wrong with the setup. Sometimes they're obvious, sometimes they're not as obvious, but we'll kind of do a little, photo adventure and see if we can kind of point out some things wrong with some of these home office setups. Okay. Oops, let me do this one. Okay. So the objectives, I kind of talked about that. Principles, practices of ergonomics. I'll talk a little bit of common injuries. I'm not going to go too in depth into specific injuries because there are so many of them. We could be here all night. But again, if you have specific questions, please feel free to email me. And then I'll give you some tips, some options on how you can improve workstation ergonomics. Okay. So I just kind of went on Google Image and found some workstation setups. And while we're kind of going through them, just take a look, see if you can identify what might be off or what might be good about this setup. The one thing that sticks out most to me is the glare on the screen. So when you're looking at the glare on the screen, that can result into eye strain, which can then lead to fatigue. And we'll talk a little bit more about that later, but the glare on the screen, that's something that we would want to fix. And when we're looking at this desk, this one is an adjustable desk. We'll talk a little bit more about that as well. So you can adjust the height. So I do like that. I do like the lamp here in the side for task lighting. Lighting is also important when it comes to eye strain, when it comes to, optimizing your setup. We'll talk a little bit more about that as well. So those are kind of the big things. I don't love that chair, but we'll talk more about chairs coming up. All right, what about this one? So this one to me looks very awkward. The chair is not a great chair. The chair, if we're starting with that, it doesn't have supports for the arm. And also the way that desk is set up, it looks to me, without a person in it, it could be kind of challenging to see, but it looks like someone's going to have to bring their arms up in order to rest it on the table, right? It's not kind of at their lap level. So they're not going to be able to maintain kind of a 90-degree elbow, which we'll talk about, and they're reaching. So I don't love that. I also don't like the thickness of that table. There's something called contact stress that we'll talk about, but it's those really kind of sharp edges along the table. When you're resting your hands on it, you can get compression injury. And then I do like that the screen is elevated, but I would be interested to see how a person fits there because it looks like it might be too high. Those are my big ones with this one. I don't know if you see anything else that looks, off or good, but those are my big ones with this one. Okay, here's a different setup. With this one, again, we're seeing a glare on the screen. And part of that is coming from the way it's positioned. So the setup is set up right in front of a window, and those windows are open. So that's going to cause some glare. It's going to cause some strain. You're going to have some contrast things going on with the eyes. So in this particular setup, I would worry more about the eye strain that's happening. This desk also has a very wide edge. So it would be interesting to see how the person fits in it. But the big thing with this one, why I put this one on there, was the setup. The desk in front of the window, I wouldn't recommend that. If that's the only option, that's okay. But we want to make sure that we have blinds if we need to. Okay, this little corner setup. So this setup I don't love because of the way it's going to make somebody twist. So if they're straight to their keyboard, they're going to be looking to the right for their monitor. And over time, that's just going to cause some stress and some strain on the neck. That's pretty much the big reason with this one. You want the computer to be center. And we'll talk about dual monitors when we get there. This one's not applicable, but I would prefer the computer to be centered in order for that one to be a little bit more ergonomically friendly. This one I picked for laptops. So laptops are okay in moderation. So if you're doing an all day 8 to 10, 12 plus hours on the computer, if you have a laptop, I would highly recommend getting a setup for that laptop, because a laptop is going to impede your ability to adjust the height of the monitor and the keyboard because they move together as a unit. So there are all sorts of kind of adaptations for that, where you can adjust, how your monitor or your laptop is sitting, so it's not flat on a table. Because when it is flat on the table, chances are you're going to be reaching forward, and you're also going to have a forward tilt and a downward gaze, which is going to start creating some stress and some strain in your neck region. So I would avoid that if you can for long periods of time. And this one. So this is another adjustable desk. You can kind of see the legs of the desk. They go up and down, which is great. We'll kind of talk about those later. What I don't love about this is his posture. And it depends. If he's like this for a little bit of a time, maybe he's standing like that for 10 minutes and then he adjusts it and he's back to a seated position, that's one thing. But if he's standing the way that he's standing for a long period of time, he has a tilt in his hips and he's not evenly distributed in his feet. Another thing is he's using 2 different monitors, but they're 2 different heights. And it looks like his primary computer is his laptop based on the way it's positioned. So whatever computer is your primary laptop or primary computer, you want that one in front of you. If you're using 2, you want both of them in front of you. If you have one that's a primary and one that's secondary, your primary is in front of you, your secondary is next to you at about 30 degrees. It looks like for him, if this was his setup and that laptop was his primary computer, I would recommend that he elevate it. I would actually recommend that he switch that so that the monitor is his primary and then the laptop is his secondary, but same height. Let's see. And then this one. there's nothing good about this. But I mean, I'm guilty of this all the time with my handheld devices. I don't necessarily have to be working. This is like my Sunday afternoon routine. But he's getting some contact stress from that table ledge. His legs are crossed, which is putting more pressure on the heel on the table. His wrist is not neutral. His gaze is forward and down. And he doesn't really have a whole lot of support in his back. So this is kind of an extreme exaggeration, but it does happen, especially when we're working from home. We get on the couch. It happens. And then I wanted to include this one too. This is a nice setup. This is an adjustable desk. You can see how it is when it's lowered and then how it is when it's elevated. So there's not a ton here that I think is really wrong. The chair, we'll talk about the chair. I would switch out the chair, but other than that, it looks pretty good. Okay. And then we'll kind of talk about, you know, general ideas, general principles with ergonomics. It is not a one size fits all. You know, there are general guidelines, but it is customizable based on the needs of each individual person. You know, we're not all the same height, we're not all the same weight, we don't all have the same work demands. So take this as kind of a foundation, and then specific questions, please feel free to email. But when we're looking at your correct sitting posture, you want to have your arms parallel to the floor. So you kind of have that 90-degree bend. This picture gives a 90-degree bend plus a little bit more. A little bit more is okay. What you don't want is an extended reach. So 90 degrees is ideal. A little bit forward is okay too, but avoid that extended reaching. You want your shoulders relaxed, and then you want just minimal bending on that wrist. You want your wrist nice and neutral. In terms of your gaze, you want the computer to be in front of you, and you want to minimize neck movement. So if you're having to have a downward gaze, your computer is too low. Same principle is true if you're too high. If you have dual monitors, you want to make sure that they're close together, and ideally they're angled slightly in like a V pattern so that you can use peripheral vision more than you're using neck movements. Your chair should have a backrest, it should have armrest, it should be adjustable. Your thighs parallel to the floor, your feet parallel to the floor. Use a footrest if needed. So you'll hear like 90, 90, 90. That's a really good rule of thumb. 90 degrees in the elbows, 90 degrees in the hips, 90 degrees in the knees. There is slight wiggle room with that. We'll talk a little bit about that, but generally 90, 90, 90 is a really good place to start. And then when we move on into, you can look at the picture on the right. It's kind of blocked from my view with all of your beautiful faces, but you can kind of read that. Everything should be adjustable, okay? Your chair is kind of the mecca. If you have a really good solid chair, you're gonna be in really good shape. And everything is adjustable. So you wanna have the 5 wheels for a stable base. You wanna be able to have an adjustable seat height, adjustable depth of the seat. You can swivel, you wanna have adjustable armrest, lumbar support, adjustable headrest, so that you can kind of tailor all of that to you. We talked a little bit about this. Ergonomics is how the person, the equipment, the work processes, and the environment are all working together. And the workplace needs to fit the worker and not the other way around. Meaning that the design and the layout of the workstation needs to fit the worker. When you're thinking about ergonomics, I like to think of the word fit, how that person is fitting into their environment, given their demands that they have. Improper fit is going to increase your injury risk. I thought this was really interesting. So 80% of injury risk comes from workers' habits. So a lot of that is posture. And then when we're thinking about what we're doing during a workday, we're spending 8, 10, 12 plus hours a day at work. If we're making the same, bad habits over and over, that's really going to play into some serious risk. So keep that in mind as well. Primary risk factors. These are kind of the big things you want to think about when it's related to work-related injury. So posture, awkward static positions. Force, that's lifting, pushing, pulling, grip, pinch. In terms of like a work environment, that could even be how much force you're applying on your mouse. Repetition, frequency, duration. Contact stress is localized, sustained, or suddenly applied compressive force. We'll talk a little bit more about this and how it applies to carpal tunnel, but just kind of keep that in the back of your mind. It's compressive force. And then vibration, frequency, and amplitude. All of these risk factors are impactful after just a couple of hours, some even less. So it doesn't take hundreds of hours and weeks and months and years for some of these issues to start becoming, impactful. It can just be within a few hours, and some even less. Okay, we're going to talk a lot about posture. But poor posture creates local mechanical stress on your musculoskeletal system, which then translates into progressive pain. So it might start as kind of an annoyance, and then it might build, and it might build and build until it's debilitating. And it might build into the point where you have chronic pain. So it's much better to kind of nip it in the bud before it becomes something debilitating. So it can lead to dysfunction pretty much anywhere: your neck, your shoulders, your elbows, back, wrist, hands, fingers, hips, all of it. The most common complaints are going to be your back, shoulder, and your legs. And then typically what we're seeing is the tissues that are most involved are your nerves, your tendons, and fascia. So you can kind of see with pictures, general aches and pains. We'll talk more about that. Consequences of poor workstation fit, aside from the ergonomic injury, which we also hear called cumulative trauma injury, overuse syndrome, repetitive motion injury, we also have increased out of work expenses, increased lost time claims, increased fatigue, increased work task errors, and decreased productivity. So there's, more than just a physical, consequence of poor workstation fit. I don't know why this guy's standing like that, but I do like that it kind of points out different types of areas and different types of injuries that poor posture can result in. So you can see anything from headaches, TMJ pain, so pain in your jaw, bursitis, carpal tunnel, anything from degenerative disc disease, ligament sprain, muscle strain. You can kind of take a look at all of those. Those are all common injuries for poor posture. These are all things that we can see from poor ergonomic fit. So we talked about that: myofascial pain, nerve impingement, neuritis, so numbness, tingling, even arthritis. I do want to talk a little bit about carpal tunnel. I feel like carpal tunnel is often associated with work-related injury, so I wanted to touch base on it. And it is very preventable. So what it is numbness and tingling in the hand that occurs when the median nerve is compressed. It happens because of contact stress. Very, very common, more than 3 million cases a year. The thing that I think is most interesting about carpal tunnel is that the average days away from work due to a carpal tunnel syndrome is 30, which is slightly more than average for the amount of days that are taken away from work due to amputations, which I thought that was really interesting. So you can kind of see how it builds up. if you are experiencing carpal tunnel syndrome, the hallmark is numbness, tingling in your thumb, index, middle, and half of your ring finger. And this is how it happens. So when we're looking at this picture, you can see right where his wrists meet the table, that's contact stress. So he's putting that compressive force on his wrist. And what's happening is it's causing compression of that median nerve. Other than that, his setup is not too bad. But that is something that we want to fix. We don't want to have pressure. We don't want that contact stress on the wrist. I thought this was fun. If you type 50 words per minute for 7 hours a day and use less than 1 ounce of force, you are generating about 700 pounds of force per finger per day, which is a lot. So we want to be mindful of, our positioning. We're putting our body through a lot of work, a lot of demands. And like everything else, our body goes through wear and tear. So we want to really optimize our positioning. We want to optimize our environment so that we can have that longevity and decrease, early dysfunction or any dysfunction. With that being said, no one size fits all. So we are fitting the workstation to the worker. There are the big 3 considerations, however: the chair, which we talked about, workstation, and your monitors. So coming back to that chair, it's super, super important. I would argue that the chair is the most important part. You want it adjustable. Make sure it's adjustable, because one size doesn't fit all, and one position held all the time isn't ideal. So having the flexibility and the freedom to make adjustments as needed is going to be really beneficial. So invest in a good chair. Workstation. She has a good workstation, nice and clean, ergonomically friendly. Her chair looks like it meets all of the criteria, and it's an adjustable workstation. So if you have an adjustable workstation, what they say is alternating between sitting and standing. And kind of a good rule of thumb is to do 20 minutes of sitting, followed by 8 minutes of standing, and then 2 minutes of movement. Taking kind of a little bit of a movement break, and then repeating that, that sequence. Good things with workstation or options: adjustable height like this one, I like those. Waterfall edges. So waterfall edges are when you have more of a rounded corners. I guess they're not that harsh, like 90-degree sharp. Rounded waterfall edges. That's going to help reduce contact stress. You want your workstation to be deep enough to accommodate your monitor, your keyboard, your mouse, and any documents that you have. You want to have clearance for the legs, and ideally you have task lighting. So task lighting is kind of indirect lighting that's going to help illuminate your workstation without being directly, in your face, more or less. I like these pictures because it kind of shows how easy it is just to kind of make that little switch from sitting, adjust it up, now you're standing. Posture. Posture, very important as well. You want to think neutral. Okay, your head is level or it's slightly downward. And emphasis on the word slightly. It's not the laptop flat where you're really looking down. It's just a slight downward. Head level or slightly downward. You want your shoulders relaxed, elbows at 90. You want to be sitting upright or slightly reclined. Again, emphasis on the word slightly reclined. Your wrists are neutral, which means they're nice and straight. We're not really bending them up. Your knees are at or below your hip level, and there's no pressure on the back of your knees or thighs. If you're taking this to a standing position, you really want the weight to be evenly distributed in your feet. So we don't want to have kind of that little cock up of the tilt of the hips. We want to be nice and straight. Same other principles apply here. Shoulders relaxed, your elbows are at 90 degrees. You're not reaching forward on your workstation. Okay, He's doing like everything wrong. He's looking straight down. You can see his neck is tilted forward. His upper back is rounded. One leg is behind him, one leg is in front of him. His hips are not at 90. His knees are not at 90. He's got contact stress going on in his hand. This is not a very good workstation, especially for long term. If he is just here for a couple minutes, whatever. But if this is an all day thing, he's going to be in a lot of pain and probably not in a very long time. It won't take long. There are a lot of ergonomic options. There are pros and cons to all of them, but we'll talk about them. First, you have your forearm support. So that's the picture at kind of the top of those pictures. The forearm supports can help alleviate some pressure, and they can kind of just help glide movement. So those can be really good. The con with those ones is that they can also be a little bit limiting in movement. So if you have a work requirement where you need to be typing and writing, these can kind of become cumbersome. Otherwise, they can be pretty nice. They take some of that stress and some of that force off. In that same picture, you can see the mouse. That's a vertical mouse. That's a good option. Pros and cons to everything. We can talk a little bit more specific. If you have questions on specific mouse options, let me know. But that is what a vertical mouse looks like. And when you're thinking about, I keep wanting to say mice, when you're thinking about mice, when you're thinking about the mouse that you're using, you want the movement to come from the force of your hand. So the pressure of your hand is gliding it. You want to avoid having a grip, right? You're going to have a little bit of a grip just to keep that mouse in place, but you don't want to be really gripping that mouse. You also need to make sure that that mouse fits your hand. So if it's too big or if it's too small, it needs to be just right. But yeah, footrests are great if your workstation is a little bit higher, if you're on the shorter end, to keep your feet elevated, to keep them from dangling. You don't want feet dangling. That can cause a lot of stress on your hips. Your monitor stands, they kind of have like the swivel stands. I like those. Anti-glare, privacy screens, those are good options if you have lighting that just constantly creates glare. That can help reduce some of that strain. Document holder, if that's applicable for what you do. Headphone sets, I think, are great if you're on the phone a lot. A lot of times what we see is bringing the ear to the shoulder and then holding that position, or kind of just tilting the head. So the phone headsets can take a lot of that stress out. Can
I ask you one quick question?
Yeah.
That armrest, can that go below the, like if your desk is too high, can that grip onto the desk and make it lower? No, I guess not. It's only higher than the.
There's different options for some of them. Like I've seen some that are a little bit more springy. So if you push pressure down on them, they can actually kind of glide under the desk. And then when they come up, they kind of just kind of support your hand so that you're kind of floating. So the armrest doesn't kind of crash into the edge of the table. You're able to rest your forearm with that support and navigate the mouse. But it will kind of depend on, there's different manufacturers. If you get one that has like more springy, more bounce. Yeah.
Okay.
Did that answer your question?
Yep, thanks.
Okay. Split keyboards, there's a lot of different keyboard options. There's a lot of pros and cons with them. I mean, if you're looking at the keyboard that's on the screen, I mean, that's going to take a little bit of a learning curve to work that if you're not used to it. And that's kind of the big con for all of the keyboard, the ergonomic keyboard options, is you know, they're different design than we're used to, or some of them have different placement of where the keys are. So if that's something you're interested in, I think that there are some great benefits to them. But, you know, with the caveat that a lot of them do require a learning curve. So it might be frustrating at first to kind of work that out. Voice activated software, that's a little bit on the higher tech side. I mean, you can probably guess what some of the cons to that are if you have Siri. But, you know, if you're really limited or have a lot of demands for typing, that could be an option. And then we talked a little bit about mouse options. The trackball, that's going to take some of the, you know, split some of the demands and kind of spread the love, I guess. So you're using fingers as well. The vertical mouse, and then the touchpad. Touchpads are not ideal. So thinking like the touchpad on the laptop, because it creates a lot of stress on your index finger. I think I have a slide about that. We'll see. Yes, okay. So moving into laptops and handheld devices, because these are a lot of, you know, components that we use in a day-to-day basis as well. Maybe not laptops for all of us, but certainly handheld devices. Neither of these are ideal for prolonged work. I mean, the picture on the right, you can see how all of their posture is impacted by what they're doing. They're all looking pretty much straight down. They have awkward postures with their wrist, with their grip. And then same thing with the picture on the left with the laptop. Even though she does have a rising desk, she still has that downward gaze. So her elbows are okay. They're about at 90. She has a little bit of a reach. Her posture isn't great, but really her gaze is straight down. So she has that forward tilt and that straight down gaze. So you're unable to make monitor height and keyboard adjustments when you have a laptop. They have kind of workarounds for those, but if you can avoid working all day from a laptop, I would highly, highly recommend that. And then mousing creates overuse of the index finger. And then when we're talking about handheld devices, texting and scrolling, that can create overuse of the thumb. So we want to kind of limit how much time we're spending on those devices. Lighting and vision. So setup is really important with lighting and vision. As we talked about in one of those pictures with the setup where it was in front of a window with the windows open, ideally your monitors are placed perpendicular to windows. And if that's not an option, if that's not available, or if you're perpendicular and you're still getting a glare, invest in blinds. You want to take out some of that light for the benefit of your eyes. So indirect lighting is better than direct lighting for glare reduction. Position your workstation between overhead light fixtures if possible, if that's applicable. Sometimes you have kind of the overhead light panels. If it's directly over you, it's less conducive than if they're next to you and you're sitting in the middle in terms of the lighting. Direct lighting to the eyes creates a reduction in vision. So that's where task lighting comes in. So I'm a big fan of kind of desk lamps where you can turn the light on, you have lighting, but it's not direct light to your eyes. Also, regular vision care, you know, see your eye doctor, keep your monitors clean. All of that will help with vision and glare. A good rule of thumb with lighting and vision is the 20-20-20 rule. So every 20 minutes, you want to take 20 seconds to look at an object at least 20 feet away. I'll repeat that later, but 20-20-20. That'll kind of help protect your eyes. You also want to take ergonomic breaks. So you have that 20-20-20, that's kind of your eye break. And then you want to take mini breaks. Frequent breaks are the way to go. So a good rule of thumb is every hour for 3 to 5 minutes, but I would even encourage more frequently than that if possible. These are a bunch of stretches. If you do all of them at the extended time, 2 times around, you're still going to get all of those done in less than 5 minutes. So that's going to kind of help relieve stress. You can see it's relieving stress in your shoulders, in your side body, in your neck, your wrist, your back. I would just, use this as a guide. This is pretty much perfect. So 20, 20, 20, and then take those mini breaks at least every hour for 3 to 5 minutes. Stretch your body. And as they say, an ounce of prevention is worth a pound of, I can't read it, cure. You guys are blocking.
Pound of cure.
I'm like, what does it say? But yes, so you want, prevention is king, right? You want to prevent anything before it becomes a problem. And that's going to be with habits. It's going to be with environment. It's going to be with, investing in quality equipment. Not all of it is, financially, out of reach. Some of it is pretty affordable. Some things are going to be more cost prohibitive, but depending on how many hours and how much time you're spending looking at a screen at work, it's worth investing in, for sure. And then that's really all I have today. Yeah. Any questions? Yes.
So I have a question. I work with mouse mostly.
Mhm.
So I never tried this vertical. What's your opinion? Do you like it? What's the...
Yes. So the vertical mouse will help because you're kind of holding it. So here's like your regular mouse and you're coming at top.
Yeah.
The
like
vertical
this.
mouse, you're going to hold it more like this. So it kind of is keeping your wrist in a little bit more neutral, and you're moving more this way than you are this way. I mean, it's similar. It's a preference thing. As far as the mouse goes, my biggest concern is where your wrist is hitting. So if you have the type of desk where you're going to get contact stress based on where that mouse is.
I have this thing with a soft, like pad on it. So my wrist goes like this,
Yep, and that can take some of that stress off. It still is pressure, so keep that in mind. It's not as harsh, it's as, the corner of a table, but a vertical mouse is designed to kind of reduce that. But the problem is that you can start getting pressure on this side, depending on how it's fitting. You don't want your hand like dragging on the table. And then, yeah, you can also have, depending on how much like mouse clicking you're doing, that might also be a consideration as well, because the mouse is here and you're going to be clicking up here. So it's a preference thing. I can't say that I have a strong affinity for a vertical mouse over a regular mouse. I'm more concerned about where the pressure is hitting in your wrist. So it's a comfort thing too. Yeah.
And what do you do at the rehab specialist? Do you how can you check the position of the workstation for patients, or can somebody make picture of me and can you advise how because I sit a lot of hours at the table.
Sure. Yeah, you could always send me pictures of your workstation, what you're using, kind of in more of a individual email, and then I can kind of look and see what you do have, kind of get an idea of what's might be going on. If you're experiencing pain somewhere, I can kind of see if I can help troubleshoot what more personalized suggestions. I would be happy to do that.
Thank you. Thank you so much.
Yeah. Right. Anything else? Was that helpful?
Yeah. How do you, so if you're trying to measure, I'm trying to figure out how how high a chair should be, how high the desk should be. So feet flat on the ground and then measure sitting and then 90-degree angle with the
Yeah,
arms, I imagine.
yeah. So you,
Frozen.
sorry, it's kind of like cutting in
I'm
and out.
sorry. I think I'm sorry. I'm gonna stop my video. Okay, that might be better. Can you hear me?
I can hear you. Yeah.
Okay. Okay. Yeah, no, I just found some, I might email you later. I found some desks that go up and down.
Yeah. Send me an email and then we can kind of go
I'm
over.
sorry.
Yeah.
we'll figure it out. But
Yeah.
this is helpful. Thank you.
Yeah. We'll figure it out.
I've added both of our contacts into the chat. So if anyone has any questions, feel free to email us there. If anyone hasn't been to our office before, we take most insurances. You can get a prescription for occupational therapy from your doctor or referral. We can be more than happy to help get you scheduled then with Mary. So she sees patients at our Santa Monica, Beverly Hills, and as well as our Encino office. So she'll be there at all of our offices on specific days. So whichever days you're looking to come into, she can help out. If anyone else has any questions.
So how do you work with the patient? Do you do therapy or you advise on the setup of the workstation mostly?
I mostly treat patients. So orthopedic injuries, some of it is work-related injuries.
I see.
If somebody has carpal tunnel, they can come to me and I can help work on exercises for that. But ergonomics kind of fits within occupational therapy domain, and that it's how you're interacting with your environment. So, if you have specific questions, we can kind of troubleshoot that to help prevent injuries so that you don't have to see me.
Thank you. Yes, that's great. That was nice to talk to you. Thank you.
I'm an esthetician, so I'm not sitting at a desk. I mean, sometimes I am, but I'm also working like over people, and your example of everything that you do wrong is kind of how I work all the time.
Yeah, I understand.
I'm gonna try to make some adjustments, and taking the breaks and stretching things definitely seem to help. Do you have any other suggestions you can just throw out?
Yeah, definitely the stretching is going to be really important for work like that, when you just can't really avoid being in kind of those awkward positions. Other things that you can do is kind of look at the positioning of the way that you're holding your tools, like if your elbow's out, and being a little bit more mindful of the way that you're holding your body when you're working with them. So sometimes you can't avoid it. There's going to be some of that, but making sure that you're, not bending and lifting with your back, you're using your legs, that, we're trying to still maintain balance in our posture. I think that will be really helpful, is kind of that general positioning. And a lot of times it's just kind of that mindfulness of it. If you're starting to, notice a pain somewhere, being like, what am I doing that's kind of contributing to this pain? Am I holding my elbow out? Am I tilting? And that can kind of help alleviate some of those issues as well, just by making adjustments in the way that we're working and the way that we're moving. So keeping things close to your body, anything that's heavy, I don't know if that really applies, but, keeping things closer to your base. So, if you're reaching, you're not bending, you're keeping it close. So trying to keep things closer to you so you're not, you know, really reaching, if that kind of makes sense.
Yeah.
Yeah,
Thank
but definitely, the stretches, those stretches that I gave you would be really good for you too, because you're using your hands, you know, you're, you know, constantly moving your neck up and down, and yeah, yeah,
Thank you.
you're welcome. Alrighty.
I actually had a question, Mary.
Okay.
So you mentioned that for someone who has dual monitors, it's okay to have it in a V position.
Yeah, you want to, it's actually better to have it in a little bit of a V position, based on kind of where your eye gaze is. So if it's flat, that's more surface area that you're having to kind of, you know, share that gaze with. But if they're angled, you have a little bit less. And so your gaze can kind of fit with those monitors a little bit better. And then instead of doing as much like side to side movements, it's a little bit more conducive to just kind of littler movements, more eyes. Yeah.
Right.
Yeah.
And then for some of us who are, let's say, more of those to-go people, times when I'm using the laptop, what are some, I guess, best tools that I can have that'll help me have a good workstation anywhere I go? So I know you mentioned, you know, having a wireless mouse. Is there anything else that you can also have?
A wireless mouse would be really good. You could look into, I don't know how feasible it would be. I'm just kind of throwing this out there, but I know that they have kind of like the detached type of keyboards, that you can kind of fit. I don't know how they work with laptops, if at all. This could be off base, but you could look into having one of those detached separate keyboards so that you can bring your laptop higher, but then work at a surface on the keyboard that's lower, so that you're not having to compromise either your gaze or your position in your arms, so you can still be relaxed. So like right now, my laptop's sitting on a printer, but if I were to type, I'm going to have to bring my arms up. But if I had a separate keyboard, you know, that I could just pop in with like a wireless technology or whatever down here, then I still have pretty good body positioning. I'm just using an adapted piece of, you know, equipment. Yeah. Otherwise, I would say, you know, if that's the case, more frequent rest breaks, more frequent stretch breaks. Yeah, especially around the neck. Yeah.
Right. Okay. Thank you.
You're welcome. All righty.
Well, if any, like I said, if anyone else has any questions, feel free to let us know. Our emails are both in the chat. If you had questions about our office or your setup, feel free to email Mary. But we hope you enjoyed today's, you know, presentation. We do have some more coming up in May on a bunch of different topics. So just stay tuned for those.
It's a good idea. Keep doing this. But no, I got to tell you, I can barely move my neck, and most of it's happened in the last year. It's really bad, really bad. Anyway, so hopefully we can get a new desk and stuff and minimize the pain.
Minimize, yes, yes.
All right, thank you guys. Have a good night.
Thank you.
Thank you, everyone. Thanks so much.
Thank you.
Thank you.
Bye.